I'm Dr. Scott Saunders with NaturalEDoctor.com. I want to talk to you a little bit about disease. Diseases are not defined because there's a problem. Diseases are defined because there's a solution. Let me explain what I mean. 10 years ago, if you had erectile dysfunction, they would have said, oh, well, you know, deal with it. That's just a minor irritation that you have. Well, now it's advertised to the doctors as a very important disease or condition that they need to diagnose. Why? Because there's a drug to treat it. 5 years ago, there was nothing for fibromyalgia, and there was this big debate going on as to whether it was even an illness or not. But now that there's an FDA-approved drug for it, it becomes a very important illness that all doctors need to test for in order to diagnose it properly so that that drug can be prescribed. This has been going on for many, many years, since the early 1900s, when a gynecology professor wrote an article in the AMA journal about how cystitis was the bane of the gynecologist's existence because these hysterical women were coming in with this phantom pain that they were having in their bladder. Well, come to find out what they had was cystitis, and it was an infection, but there was no treatment for it. But as soon as penicillin and other antibiotics became available, all of a sudden it's a disease that has a diagnosis and a treatment. In the same sense, if you look at some of the illnesses that you may have heard about, like cholesterol. Cholesterol, for example, was not a problem until there was a drug available to lower cholesterol. And then it was created as a problem, a health issue. It's not really a health issue. It's an indicator of health issues that people might have. For example, the cholesterol can be elevated when you have high levels of insulin. And insulin is a growth factor that tells your liver to make more cholesterol. So the problem may not be the cholesterol itself. It might be underlying that is insulin. Well, why do you have high insulin? Because of eating high carbohydrate diets, like sugars and starches and processed grains. So sometimes the problem is only defined when there's a treatment, even though that treatment isn't the proper treatment for it. For example, 60% of people have their first heart attack have perfectly normal cholesterol. And that doesn't bode well. There's actually no correlation, no good correlation between high levels of cholesterol and having heart attacks or even atherosclerosis. So it's important to remember whatever disease you're diagnosed with, why is that diagnosed? Probably because there's a treatment for it. And then look very carefully to see if the treatment is the right one for you.